Hi, welcome to the Realm of Caring, AutismOne LiveStream. My name is Courtney Collins. I'm the Education Director. Welcome back.
Hi, and my name is Lacey. I'm the Development Officer with Realm of Caring. I'm so glad that you can join us today.
Yeah, so the last 2 days, the first day we presented a little bit about getting started and what that looks like on cannabinoid therapy, especially within patients or clients with ASD, if you will, as well as some research behind our observational research registry yesterday with Joel Munson and myself. And then today we're going to talk about frequently asked questions. So we do have a care team that is open from 9 a.m. to 5 p.m. Monday through Thursday, Mountain Standard Time. And we'll give you the phone number for that. Well, it's right there on the slide on the bottom. And you can call us. It's a free consultation.
Correct, yeah, and we're able to provide product and administration suggestions and provide individualized care plans for individuals that are looking for alternative methods of healing. So not only do we help you to get started with therapy, we also help to support you along your journey or your loved one's journey to wellness. We have financial assistance programs, doctors on that can help you and answer any questions that you have. So we're here as a resource, and please use us as little or as often as you like. We're always here to help.
Yeah, let's get started. So the next slide.
The next slide is about Zakai, and Zakai is Heather Jackson's son, and Heather is the founder of Realm of Caring. Zakai had seizure onset 4 months, almost daily seizures for over 9 years with a DOSA syndrome as well. Zakai was on multiple pharmaceutical medications, all that did not help very much with his quality of life. Starting on CBD in 2012, Zakai is still going strong and having less and less seizures. He's a teenager now, so seizures might be recurring with hormones changing, but he is still pharmaceutical free. He's learning and he's very social. Significantly reduced autistic tendencies, and he's sleeping better. He's more social, better appetite, and a lot less negative behaviors.
He just turned 16 on Saturday.
I know,
which is super cool.
Which is really awesome because Zakai wasn't expected that he would live past the age of 10. So now we celebrated Zakai's birthday last week, and he's doing really, really well, and we're glad to see this young man grow up.
Yeah. So this is a little bit about who we are. It encapsulates our mantra, if you will, because quality of life matters. And, we're an independent 501c3 nonprofit based in Colorado Springs, Colorado. And we are reimagining the way we think, talk, and respond to cannabis and those who use it. So we're collaborating on research, we're providing education, and really giving the tools for people to lead better lives. And that is an acronym. So R for research, E for education, A for advocacy, L for improving lives, and M, measurable results. We do see wonderful outcomes when people rely on us, our clients get in touch with us. I think almost to a 80% success rate, at least symptom relief and some condition relief from using cannabinoid therapy correctly.
Perfect.
Yeah.
I agree. So now you see the roadmap, and that's our quality of life guide. So when you call Realm of Caring, it kind of gives you an idea of what we're going to be asking you about and how to get started. So we start with, what are your conditions? What are your symptoms? What are you looking to utilize cannabinoid therapy for? Second, we ask, what does the research suggest? We do have a research library of over 600 research articles on a multitude of medical conditions. So we are able to pull research articles for specific conditions, as also all of our research-based suggestions for dosing protocols as well. We also ask, what's the use of pharmaceuticals and your current weight, your personal pros and cons, and what your outcomes are for utilizing cannabinoid therapy. Where do you live? Because that does determine what types of products are accessible to you. And then let's get started. We're able to provide some product and administration suggestions based on you and your needs.
That's right. Thanks, Lacey.
Thank you.
Get started. So let's dive into our frequently asked questions. Now, this is something we've collated, I would say, or collected over time in the sense of what are people asking us about when they call or contact the Realm of Caring. You can email us too, of course. So what are those frequently asked questions, those high traffic inquiries. And the first.
Yeah, so we can talk about our demographics. That is a frequently asked question. A lot of people do want to know, who do we serve and what that demographic looks like. So we did start off with a lot more pediatric clients back in the day when we started in 2013. We do see a lot more adult clients nowadays, mostly with pain and seizure disorders, as well as cancer and anxiety, and arthritis being in the top 5. With our pediatric diagnoses, we're looking still at a high number of seizure disorders. ASD coming in at 17% of the people that are contacting us were pediatric clients. ADHD, and then CP and cancer will be the next that follows.
So what are the ROC's current research initiatives? We do get asked, well, you do research, but what kind, or with who, or what does that look like? So our largest project, I would say, or investigation is our Observational Research Registry. That's our ORR, if you refer to it. We refer to it throughout the show, if you will. It's our IRB approved, and we do that in collaboration with several universities, two of them being Johns Hopkins and University of Pennsylvania. It was launched 2016. It's open to anyone with any condition, whether they're using cannabis or not, which is really great because we have a comparison group to show those who are not using cannabis as well as those who are. It's the largest cannabis observational study in the U.S. And when Heather Jackson, our co-founder, she spoke to Dr. Raphael Meshulam about what's the next best thing after doing a double-blind placebo clinical trial, he said an observational research registry, much like this, an observational study. It's an epidemiological study, so it's over time. We just closed the last data set, and we are looking to publish this year in several peer-reviewed
JAMA, that will be coming up. So we have autism as well as epilepsy studies that we'll be publishing, so stay tuned for that.
Our other research projects, there's a metabolite study, a current NFL player study, a former professional athlete study, an adult epilepsy study at Colorado State University, and a PTSD study at Harvard with Dr. Stacy Gruber. And all of those can be found for more information on our website.
Yeah, specifically the rock.us/participate.
Yep, thank you.
Another question we get asked a lot is this legal? And that does depend on the state that you live in. I will say that CBD can be shipped to your home in all 50 states, but you may need to register with your state to obtain a medical marijuana card to legally access CBD. So please check that out before you purchase CBD, just to make sure that you're in compliance, that there's nothing of extra steps that you need to do to protect you and your loved ones. So there are some state-specific medical marijuana laws and requirements. You can find that out at procon.org. That's PROCON.org, and you can look at that, as well as some opportunities for you to get in contact with some individuals in your state, especially if you don't have access. This is a time to lobby and get in contact with your legislators to make sure that your family members have access to what helps them.
Yeah. So we often got asked, and this was back in December, actually more last year, but even this year, what is the Hemp Farm Bill in 2018? And essentially that removes hemp from the Controlled Substances Act. And you'll hear us coming up that hemp-derived CBD is really important. That's because of the THC levels is below 0.3%. But this Hemp Farm Bill allows farmers to pursue federal hemp cultivation permits. And already 40 states, I think actually 41 because Texas just got on board,
correct,
have established hemp cultivation pilot programs for industrial and commercial purposes. So imagine that a lot of more states are going to have the ability to grow this and have access to new different products and CBD products.
And not just CBD products, things textiles like papers and clothing and ropes that we're now using instead of trees. So that's really exciting to see the sustainability over time with how we can replace hemp and trees.
So even though it's federally legal, it's important to know that each individual state will still oversee the oversight of the plant's cultivation. So going back to that slide before, it's really interesting because each state will have its own state laws, if you will, an oversight of what's happening in regards to growing hemp. So what is cannabis?
So cannabis, there's over 400 chemical compounds that have been identified in the plant. Over 112 of these compounds are specific to the cannabis plant, known as cannabinoids or phytocannabinoids. Some common cannabinoids that you've may have heard of is THC, which is delta-9 tetrahydrocannabinol. I know that's a mouthful. Tetrahydrocannabivarin, which is THCV. Cannabidiol, which is CBD. Cannabichromene, which is CBC, and cannabigerol, which is CBG, just to name a few. But if you look on this slide, you can tell that there's a lot of different processes that the plant goes through, and it can start to actually morph into other compounds. So it's very important to understand what these different compounds are and how they can change over time, whether they're heated, whether they're blended or juiced and kept in the raw state, or whether they're aged over time.
And what I love about this chart is it does break it up by raw, heated, and aged, so you can see the different compounds in different states. However, our coworker Joel yesterday, he goes, what's really cool is that everything evolves from CBGA, that acidic form, and then it turns into evolves really into these other compounds.
Cannabis is a very simple yet complex plant.
Yeah, good one to see. Yes.
Another question we get asked a lot is, what is CBD and what is THC? So CBD is a major phytocannabinoid from the cannabis plant, which is known to be non-addictive, and research has shown that it has more than 52 mechanisms of action. As I mentioned earlier, we have over 600 research articles on how CBD can be helpful for a multitude of medical conditions. So just know that there's a lot of applications for CBD and that it's not medical condition specific. THC is also a phytocannabinoid that's uniquely found to the cannabis plant. THC does work by binding to cannabinoid receptors that's concentrated in the brain and the central nervous system to produce psychoactive effects. Mm-hmm. If you look to the left, you'll see that these are really similar in the chemical structure of these compounds, but they are very different and they act on very different parts of the body.
Thank you. We get this question a lot. What's the difference between hemp-derived CBD and cannabis-derived CBD? And what it comes down to, they are biologically the same plant. We have a great slide that shows that. However, it's really that THC content. So the hemp-derived CBD is less than 0.3% THC. There are still trace amounts of THC, which is important because when you talk about whole plant extract, there is some THC and you can still test positive. So we never tell people if you're using a whole plant extract that you'll come out free of testing for THC. That's not the case, and you should know that. It's really important. Cannabis, also known as marijuana, contains more than 0.3% THC, and that's really state specific, that you could only buy within your state legally. Hemp-derived CBD products are not designed to get people and animals high or inebriated, but it is, again, still possible to test positive for a drug test when using whole plant hemp products because it can be consumed and stored in your fatty tissues. Hemp can be purchased and used in all 50 states. Again, check with your states, especially for pediatric clients. And internationally as well. And of course, it's really important to be educated on the differences of hemp and as cannabis-derived CBD.
Very great, Courtney. Thank you. So just kind of expanding on the differences between medical cannabis and hemp. As we mentioned, it's biologically the same plant. The only difference is just the THC that's been allotted in the plant. So here at AutismOne, we have had some questions about what's hemp, what's cannabis, what's CBD. So just remember, hemp, less than 0.3% THC. Marijuana, more than 0.3% THC. Good. And you will need to go through your state to obtain a medical marijuana license. And if you're under the age of 21 and you're using recreational, you will need your driver's license and a recommendation. So just keep that in mind. So let's move on.
Yep. What is the endocannabinoid system? You might hear ECS for short. And really was only isolated and described in 1992 out of Hebrew University. Pretty amazing that it was only 2-3 decades ago that this came out, and we're still learning about it. However, it's not even being taught in medical schools, which is a crime. Doctors don't know about it. So a lot of people say, well, how does this work? What is the endocannabinoid system? Well, of course, it's the most important physiological system, the largest regulatory system involved in establishing and maintaining human health. And imagine that it modulates and regulates, so it pretty much balances all the other systems in our body.
Correct.
So everything that's important to how we relax, eat, sleep, forget, protect, and you can look within the organs there, the vital organs, there are CB1 and CB2 receptors that are sprinkled throughout our bodies, and really it modulates all the cannabinoid molecule will go into your body, and like a Boy Scout molecule will work and figure out, it knows where to go, it knows what to do, it knows what to fix, it knows what to modulate. And so it doesn't necessarily bind to the receptors, it just helps modulate uptake and downgrade and upgrade all the endocannabinoids in between.
Right, and the chemicals that our bodies naturally produce. We naturally produce cannabinoids. Now, some of us have cannabinoid deficiencies, and that's where we might see medical issues arise, diagnoses that are coming up, maybe autoimmune conditions, and that's meaning that our bodies are not producing enough of those endocannabinoids.
Yes.
So we need to take exogenous cannabinoids in order to fill that need within our bodies. So the goal of CBD is to regulate our bodies and return it back into homeostasis, which is essentially that normalcy. So just know that this is an endogenous system that we have, and our bodies are meant to utilize CBD to keep our bodies strong and healthy.
What's really cool is there's some preliminary research showing that there is a deficiency in folks who have ASD, and that there is a deficiency in their endocannabinoid system. So right now, researchers are working on locating the deficiencies within the endocannabinoid system, and that might help supplement later on, filling in the gaps there within our bodies. So it's pretty interesting.
Yeah, and quick fun fact, did you know that everything that has a spine, including slugs, has an endocannabinoid system? So just keep in mind, this is something that's naturally a part of our bodies.
Yeah.
So moving on into the entourage effect. So I just want to touch upon that. We briefly mentioned hemp-derived CBD and cannabis-derived CBD and THC. So all those compounds are meant to work together. So I want to make a really strong point here that whole plant extractions typically include CBD, THC, and more than 400 trace compounds like terpenes and flavonoids, chlorophyll, and all those plant components and plant waxes that's naturally occurring in the plant. So the synergy amongst those compounds is called the entourage effect. So this is the combined action that magnifies the therapeutic benefits of the plant's individual components. So the medicinal impact of the whole plant is greater than the sum of its parts.
Yeah, the whole plant extractions are superior to CBD isolates. That's pretty important. We get a lot of questions about that. Even in isolates, there still can be like teeny
Like
0.0001% THC. Depending, it's probably highly unlikely, but you could still test positive for THC over time, especially if you're using large amounts of that isolate.
Right.
But the isolate, we get a lot of questions because, people ask, well, what's better? Is the isolate better, or is this whole plant extract better?
Can I be bold and say that whole plant extracts
You
are better?
can be bold.
Okay.
But you've been on the care team for 3 years prior to development.
Right.
And Lacey has a wealth of knowledge, a breadth of knowledge, if you will, about seeing her clients on isolates versus whole plant.
Right.
And they've responded better to that whole plant.
Whole plant, because all those compounds are working together. Instead of only using CBD isolate, which is only one of hundreds of compounds, you want to use a whole plant extract as much as you can to receive that medicinal benefit.
What's fantastic is there's amazing research coming out about the importance of the entourage effect, especially within breast cancer and specific cancer types. Using that whole plant is really going to attack anti-tumoral processes in the body.
Great point, Courtney. I'm glad you brought that up. So kind of keeping along the lines of the entourage effect, I want to talk about terpenes and the effects that it has on the endocannabinoid system, CBD, and THC. So what are terpenes? Terpenes are, in a nutshell, essentially essential oils. So they're the aromatic components, which is the plant smell, the plant's odor, and it's typically made within the plant's flower bud. So that's the actual plant compound, like the flower of cannabis. It is also found in many other plants and foods like black pepper, cinnamon, and citrus fruits. And it affects the modulation of the endocannabinoid system, especially the uptake of CBD, THC, and other phytocannabinoids. So as you can see on this chart here, that there's a lot of plants that also make its own terpenes. Like apinine comes from pine needles, and it's known to have anti-inflammatory properties. Linalool comes from lavender, and that has analgesic properties, which is anti-pain and anti-anxiety properties.
Yeah.
Beta-caryophyllene is a really hot topic right now with copaiba oil. If you've ever heard of copaiba oil, it's really high in beta-caryophyllene. It has a very strong anti-inflammatory property, and it's also an anti-pain reliever, and people are diffusing that along with taking CBD.
Right.
Myrcene comes from hops, and hops is a very close cousin to cannabis that has some sleep aid and muscle relaxant properties. And limonene comes from citrus fruits, and it has anti-anxiety properties as well. I'm noticing a really strong trend here with the anti-anxiolytic properties here with all these essential oils.
Yeah.
So just know that this is a naturally occurring process with all these plants that are naturally found within nature.
I also think what's interesting is that you're seeing strains, or chemovars, which we call them,
Correct.
With specific terpene profiles, and people are responding to those terpene profiles and those chemovars pretty differently, whether it's, sativa with a terpene profile of a, linalool or whatever that would look like. So kind of an interesting thought there.
Yeah.
I love this. Are CBD products regulated? This is a really common question. People want to know about quality, and it's so important because what's scary is that CBD can come from any country, and you don't know, where it's grown. You don't know what kind of soil it's been growing in. You don't know if it has really strong heavy metals, whether it was mold or pesticides were used, if that's the case. So it's really important as how it's regulated, and it's sadly not. So there was a study done back just 2 years ago, labeling accuracy of cannabidiol extracts sold online. Basically, the problem is there's inadequate regulation and oversight of these products and accurate labeling. In the study, they purchased 84 products. They did third-party testing from something like 3 different labs. 69% of the products were mislabeled with more or less CBD content. 31% were accurately labeled. So you're telling me a third of the products that you buy that are only correctly labeled. And that's pretty scary, especially when you're medically sensitive.
Right.
And you want to have a consistent product, a good quality product that follows some guidelines, which we'll talk about next. But just think about what that means when you're just going on Amazon and buying whatever willy-nilly
Please do
product.
not just go on Amazon and purchase CBD, or purchase CBD from a gas station or a smoke shop.
Good one.
Please do your research and understanding what types of questions to ask when you're vetting companies.
Or call us.
Yes, please call us. That's what we do.
Yep. So, again, there are so many companies. What is a quality product?
So the only way to prove efficacy is to measure and repeat with consistent products. So here at Realm of Caring, what we do is we actually visit these grows where the product is grown. We visit the labs and also the shipping facilities to ensure that these are quality products. Now, we only currently support 6 companies that have been able to go through the application process. If you're a CBD company out there and you're wanting to add your product to the line of products that we support, please contact Realm of Caring. But as a consumer, we do have a Quality of Products Matter sheet you can download on our website, therock.us/Quality of Products Matter. And this essentially is asking, where are these products being grown? Where are they being tested for? Molds, pesticides, residuals. Are these products manufactured in CGMP certified labs? And then also the customer care, are they accurately able to provide what's the milligrams per milliliter and what the terpenes how many terpenes are in the product and how much other cannabinoids. As a consumer, it's your right to have access to what's called certificates of analysis. Layman's terms, they're called batch reports. So with any product that you purchase, please ask for a batch report. It's extremely important that you know what's in your product, especially helpful when you're trying to figure out your dosing.
And if the company you're buying from cannot deliver to you a COA, a certificate of analysis, or a batch report, then that's a red flag.
Definitely.
Another red flag we were talking about is if companies make claims. That is very anti-FDA.
Yes, it does this and this and cures your cancer. No, that's not how that works.
Right. If it's a good product company, it shouldn't be making claims about what it can do. So, just a guideline. But we love this sheet because it really is a great, really
handy tool.
Yeah,
that's right.
I was going to say a tool for parents or for caregivers or for themselves.
Yeah. The fact is, cannabis is safe. It's very safe, but not ensuring consistency, proper labeling, and testing can cause inadvertent effects.
Yeah. Thanks, Lacey. So here are some of the hemp-based. Remember we said that hemp piece is below the 0.3% THC level. These are hemp-based products that we have vetted carefully, went to their labs, and actually go to their labs, I'm pretty sure, every year to check out.
Correct.
And have a wonderful relationship with them. They're products that we can trust. We've done the homework for you. Here are 3 companies that we would recommend, Elixinol being one of them, Mary's Nutritionals, as well as CW Hemp or Charlotte's Web by the Stanley Brothers.
Correct. And we're able to provide information on how to utilize these products as well. So just know that if you're using these products or interested in using them but don't know where to start, please contact Realm of Caring.
The second line is quality products that we support but medical marijuana. So this is state specific, right? It's going to have THC levels above that 0.3%. So Stanley Brothers in Colorado, Florida, and California?
That's right, yeah.
Good.
They're expanding.
And then Tikkun Olam is a fairly new company here in the United States, but very old company in Israel. Mm-hmm. They have wonderful research to kind of support some of the work that they're doing and the product lines that they're developing, which is really exciting.
Yeah, research-based.
Yeah, so awesome. They're started in Florida, which is awesome, and I know they're expanding to California, and they'll probably hit up some other big states. Mary's Medicinals can be found in 9 different states, I believe. I would have to check that. But also a wonderful company, and as well as Caniatric. That's in California.
Another great question that we get asked a lot is, what is the side effects of CBD? Everything has side effects, to put it very bluntly, but there are no known serious adverse side effects that occur with using CBD or medical marijuana or cannabis in that usage. We know that chronic use in up to high doses of up to 1,500 milligrams of CBD are reportedly well tolerated in humans. There is no toxic or reported side effects when using CBD, other than an increase in sleep or lethargy, or an increase or decrease in appetite, whatever the body needs to regulate itself. So we typically see an increase in sleep for people that don't sleep or have irregularities in their sleeping habits. We see typically increases or decreases in appetite, typically increases in appetite, especially with people that have cancer, for example. So it kind of depends on who you ask if those are side effects or welcomes to improving their quality of life.
Good one. And sometimes we do see some diarrhea, if you will, vomiting.
Typically, that's associated with like high doses of oil, not the CBD.
Right.
Yeah.
Oh, yeah. Good point.
Yeah.
It's the carrion oil.
So if you're using like a 300 milligram product, right, and you're taking 4 milliliters twice a day, then you might want to consider using something that's a little bit more concentrated, so you're not ingesting as much carrier oil, because taking too much olive oil or coconut oil could cause GI upset. So just kind of be aware of what that means, and if you are having side effects, consider all those factors.
Just to be clear, unlike pharmaceutical related deaths in the United States, there are no documented deaths from cannabis overdose. You know, people always ask, can I die from this if I take too much or too many gummies? No, you'll just basically go to sleep.
And you'll wake up the next day, I promise.
So, you know, we also talk a little bit about oversaturation, and sometimes, again, that's too much carrier oil being ingested at one time, and then those rashes might be significant, may indicate drug interactions. And something else that's interesting I learned is if you take high amounts of grapefruit,
that's right.
that can be, well, we get to the potential interactions, but that's something I just learned this year was CBD and grapefruit can have an interaction. Interesting. Here we go.
Speaking about interactions, great job, Courtney. Potential interactions, CBD is metabolized in the liver by the CYP450 enzyme. So that system, a lot of other medications also uses that same enzyme when being metabolized in the liver as well. So the CYP2C9, the CYP2C19, and CYP3A4. We have this information on our website under the Guide to CBD. So if you're wanting to get more information or print it off for your doctor or physician, you can find that information there.
Yeah.
But the overview in general for any type of pharmaceutical use, whether that's a supplement, if you're wanting to utilize CBD, just be aware that we do suggest spacing CBD at least 2 to 4 hours before or after pharmaceutical medication to reduce the likelihood of drug interactions. Now, I'm not going to say that that's necessarily for all supplements, like dietary supplements, but specifically with pharmaceutical medication. And we have had some people debate that here at this conference, and I'd really like to see the research. But we do have research that is suggesting that there are potentials for interaction in the liver. And you can also find that chart on our website within the client portal.
And I think ideally we talk about blood serum testing on the bottom there. I mean, what would be amazing is if we'd had a low-cost blood test, but I know realistically blood tests are expensive. But it'd be great if you could get blood serum testing 6 to 8 weeks until a pattern's formed. That way you can figure out what's going on within your body, and also weaning off pharmaceuticals if that's your goal.
Right, and getting a baseline before starting CBD will be very helpful for you. That way you can, you can compare and see if there are any changes, and sometimes by getting those blood serum tests, as Courtney mentioned, it can help to prompt weaning schedules with your attending physician. We have had many clients that are using pharmaceuticals anywhere between 6 to 8 to 10 pharmaceuticals a day and have been able to replace their medication with CBD.
Yeah. Is CBD safe? Yes.
It does not get you high. It does not have you becoming addicted or dependent or having withdrawals or dependency issues if you ever wanted to stop. You do not need to wean yourself off of CBD. You can just stop it cold turkey. It typically metabolizes out of your body within 72 hours.
You can't overdose. It's not toxic at any time. It's even less toxic than caffeine. There are special considerations that we still think of for pregnancy, nursing, adolescence, psychiatric illnesses. We were just talking about all of this morning. So it's still in our brain all the time, making sure that we, you know, are being careful and considerate for special populations. Yeah, and this graph really depicts those toxicity levels of a Schedule 1, 2, 3, and 4 substances. We love showing this to, you know, our healthcare providers and really looking at, you know, there are, if you look at heroin, alcohol, meth, cocaine, and that far right end of the spectrum there, a lot more potent and poisonous than, for example, marijuana, aspirin, Prozac, and even less than caffeine. So LD stands for lethal dose, and essentially the lethal dose 50 is the amount of a material given all at once, which causes the death of 50% or 1/2 of a group of test animals.
Wow.
So imagine, look at marijuana all the way to the left there. It is one way to measure the short-term poisoning potential of a material. So again, we say it's very safe. And you probably see a graph like this if you were to Google it in many different forms. This is just one way that we show, you know, how very non-toxic marijuana can be.
And I also want to point out that CBD is a neuroprotectant and a neuroregenerative. We have a lot of families that have asked us today, what does this mean for my developing child's brain?
Yes.
It's not going to have a negative necessarily effect on their brain. Now, do we know the long-term effects 15, 20, 25 years from now?
No, we don't.
But no one knows that about vaping. And you see everybody else vaping and using all these different tobacco products. So I just want you to know that there is research suggesting that it does protect the brain and regenerates brain cells instead of harming the brain over time.
Right. So administration methods, how do I take this? Sublingual, that's under the tongue, which you hold for, we say 30 seconds to a minute if possible. Yeah. It's a very venous area.
And it's typically with an oil.
Yes, thank you.
So liquid product.
So that picture there with the tongue, sublingual, mouth, or the dropper, that's the idea of when we talk about sublingual. Capsules, which you see there, really easy way to administer.
My preferred method.
However, it's hard to adjust the dosing
yeah.
for capsules because it's already preset. Whereas with the sublingual oil, you can use an oral syringe to modify your dosing.
And can I add something on that, Courtney?
Of course.
So I'd also like to point out when you're using capsules or you're swallowing a product and not having it sit in your mouth, that you might want to follow that up with a good fatty food like peanut butter, yogurt, avocado, maybe a glass of almond milk. Right. That way, because CBD binds to fat, that does help to increase the absorption of the product once it's been swallowed.
Right. Then you have transdermal, which you would place a patch, for example, on the lower right-hand corner on your wrist or a venous area on top of your ankle, and that would get absorbed into the bloodstream. So Mary's Medicinals makes some wonderful patches that we often recommend to our clients.
They make 10 milligram CBD patches, and those patches last anywhere between 8 to 12 hours.
Yeah.
And it's also waterproof, so you can take a shower and that patch will still be right on your foot.
It's great. Topical, of course, that's really located to a specific area in your body and can really work almost immediately, especially with arthritis or localized pain, right? And that's a wonderful source. It won't go in necessarily all absorbed into your bloodstream. The idea is that it's very much localized.
Yeah.
Vapor, we often, for
vape
acute
pens. Like anxiety, for example. People that have anxiety would benefit from using a vape pen.
Acute migraines, I was thinking.
Migraines is a good one.
Right.
It crosses the blood-brain barrier a lot quicker, so it has the onset of a couple of seconds to a couple of minutes. So if you're having an anxiety attack or you're having something that you need assistance with right now, using a vaporization method, whether that be a vape pen or you're doing some type of nebulizer, would be really efficient for that.
It just doesn't last as long like it would like a sublingual or capsule. And then, of course, rectal dosing, which even here at this conference we've talked a little bit about, especially if someone you're taking care of is sensitive orally, if you will, or eating-wise, it doesn't like to particularly a flavor or the oil. We've talked a little bit about what that looks like with suppositories and getting oil into the system, and really it bypasses your gastrointestinal system.
Right, that's exactly right.
So, and then the last one, G-tube, G-Tube
and J-tubes, yeah. So that's
and the Mickey button.
In the Mickey button,
yes.
Right. So that doesn't exclude you from utilizing CBD. Just know that when you're using oil, specifically in those in the lines, you want to make sure that you're administering the oil first and then flushing with food or formula, or mixing the oil directly in with the food or formula and then flushing with water. Please do not administer the oil first and then flush with water. You may be losing product because, of course, oil and water do not mix.
Good point.
So how much do you take? That's a really great question. You can go onto our website, therock.us, and create a free client account if you have not done so already. So you have access to all of our dosing guidelines and calculators.
Speak to a care specialist.
That's right. And we can get you started with figuring out how much you or your child needs. Overall, we do suggest taking CBD 2 to 3 times per day, every day. The half-life when first starting CBD is about 9 hours. So that's why we want to make sure that you're utilizing CBD multiple times throughout the day. You want to make sure, again, to space 2 to 4 hours before or after pharmaceutical medications. Be aware of potential interactions, and please ask your doctor or your pharmacist if and how there's potentials for interactions there.
Yeah, frequent monitoring. We suggest journaling on a daily, weekly basis. Your notes and observations will help the care team with troubleshooting. We talked about those baseline medication levels, transition to a new bottle for sensitive clients. But what I like about this picture is the oral syringe, and it kind of shows you we talked a little bit about accurate dosing and how much to give, and really adjusting that, because you'll see in our calculators and in our guidelines that we do adjust pretty methodically.
Yeah, we dose in milliliters or drops. So you want to count out how many drops you're taking and know how much CBD that is in milligrams.
Right.
Or you want to use a syringe for more dosing accuracy, so you know exactly how much is in that milliliter.
And what's great is on our website under shop, you can find really much an oral adapter kit. So we sell the oral syringes, we sell the bottle adapter for the oral syringe, and a screw-on cap.
Yes, so we try and make it as easy as possible.
Yeah.
I also want to point out before moving on that CBD works by accumulation and saturation into the system. So it's stored in the body over time. If you take CBD once or twice, or you use it for a week, or you just try it out every other day, it's not how it's meant to work. It's meant to work every day, at least 2 to 3 times per day.
Right.
So you're allowing that CBD to accumulate into your body.
What is the therapeutic amount and half-life biphasic effect? We talk a lot about finding your therapeutic amount, not taking too much or taking too little. Higher amounts can cause diminishing effects, especially in clients with ASD. We're very sensitive to that, so it's trying to find peak effects at the optimal amount.
Yeah, so go low and slow is typically the suggestion. So you want to start at a small amount and slowly increase yourself over time. The goal is to find a therapeutic dose that works for you. So if you wind up passing that dose, right, and you've been seeing results and you decide to increase your dose, and you're regressing, then that means you need to go back to your therapeutic dose or the dose that was working for you before. Once again, the care team can help to troubleshoot your dosing with you. Just be aware to get the most out of the slide. Just know that the half-life of CBD when you first get started is about 9 hours. Over time, it builds into the body over 72 hours. So even if you stop dosing, you're still going to have CBD in your system for up to 3 days.
We do talk a little bit about short breaks, and we can help you with that, and that's if you're seeing those adverse effects or diminishing effects, sometimes resetting, it's not going to, be a problem. It kind of can help one time, and then you go back to your normal dose or lower dose and work your way up. Why slow and steady?
The bell curve and the biphasic effect that we just mentioned.
Right.
Also, Herxheimer reactions. The CBD is a strong detoxifier, so we do have a lot of people that have Lyme's or PANS and PANDAS, or might have some type of chromosomal disorder, and that really, really are sensitive to the detoxing effects of CBD. So you might want to consider doing 1 day off, 2 days on, 1 day off, 2 days on. So once again, we can help you figure that out, but we just want to make sure that when you're going at a really slow pace or starting off at a low dose, it reduces the likelihood of that happening to you and having an adverse effect.
Yep. So what are reasonable expectations? We help you with this all the time. Like, what will you measure? How will I measure? How often? How long will this take anyway? So it's really, this doesn't work overnight. For some people it does. They see immediate
within
responses.
Within a week or something like that.
Exactly. But we do say allow it up to 6 months.
Yes, 4 to 6 months realistically. It's not an overnight therapy.
So you want to tweak it. Remember we talked about labs and we talked about titrating slowly up. We typically titrate after 2 weeks time, and then come back and we can figure out what the next level would be.
Yeah, typically every 3 to 4 weeks we're going to be increasing your dosing if it's needed. And we have calculators that can help you figure out how much that's going to be. You also want to figure out what does success mean to you and your family. Is it the seizures? Is it pain ratings? You want some measurable labs so you can see the actual physical evidence that this is working in the body. Scans, also be measuring mood, sleep, cognition, and overall quality of life. Even if you're not seeing improvements in the actual medical condition, what are some areas that you are also noticing some effects?
And then measuring it, making sure you're consistent, doing it daily. Being objective about your those successes, and if your seizures are really reducing or if the pain is really reducing. Tracking online tools, we'll get into that next. Oh, and of course, entering our Realm of Caring Observational Research Registry. It's the best way to track. Mm-hmm. So, how do I track my plan and progress?
Managing your expectations. You can go into their client portal and you can download that PDF. You can also use a written journal. You can purchase that on Amazon. If you're still into note-taking, of course, Courtney mentioned our ORR. And also, there's an app for that. So if you're on your phone a lot and you like to track things through an app, there's a great app called Relief, RELEAF, String Print, and then there's also a journal in that app if you want. But there's all different types of ways that you can track your therapy.
How do I talk with my provider? We actually have a great PDF on our website that you can download and gives you some guidelines for this.
And also, this is just one tool in your toolkit. Please know that CBD is really well taken with an active and healthy lifestyle. So getting enough exercise, eating quality food, getting enough sleep.
Yep. It's not a silver bullet. CBD isn't going to fix all of your problems. It's really important to incorporate this into a health and wellness regimen.
Yes, a lifestyle.
Yep. And our last slide, we care a lot.
It's kind of our thing.
Go to our website, become a client, call us, email us, and of course we are a nonprofit, so we operate on donations to keep the lights on at our office in Colorado Springs.
If you'd like to donate to Realm of Caring or just love who we are and what we do, you can always go to our website and click that donate button on the right-hand side of our website and join our Friends and Family program. We love to see you part of our family. If you need anything, please contact us. We're more than happy to help. If you're a physician, you can register on our website, create your physician's account so you can get educated and help your patients.
Right.
If you're a client, go ahead and log in on our website, create your client portal, get access to those tools that'll help you be successful in your therapy.
So thank you for tuning in today at AutismOne and listening to the Realm of Caring, and reach out if you need us. We're here for you.
We appreciate you. Bye.
Bye.